Welcome. This is an Iowa Online Nurse Residency Program Resident Spotlight with Program Coordinator Amanda Boucher. Today's guest is Nurse Allie Compaan from Ridgeview Medical Center in Waconia, Minnesota. Allie completed the IONRP in September 2025.
Good morning. I have with us today Allie from our September 24 cohort, and I am so excited to talk with her today and her experience through the residency program. So, Allie, if you just want to kind of share with introducing yourself, what facility you work at.
Yeah, I'm Allie. I work in the emergency department at Ridgeview Medical Center in Waconia, Minnesota.
And how long have you worked there, Allie?
I started at the end of last July, so I'm coming up on 1 year.
Yeah, awesome. Super exciting. Did you always think you would end up in the ED setting?
I knew I wanted to do some sort of critical care. I wasn't sure if that would be ED or ICU, but I had an internship in the ED before I graduated and ended up really liking it.
So I'm curious, how have you been able through the program, those different concepts that we talk about throughout the program, how have you been able to apply those in your work setting?
Yeah, I think it's been helpful this program has helped me to give myself a lot of grace as I grow in my practice and also to just set realistic expectations for the first year of nursing. There's a lot of newness that comes with it, and a lot of the content that we covered help to be a reality check of what's normal versus what's not normal in the first year.
Yeah, and I like how you said that first year, it can be a little bit of a reality check. We talk about that transition from school to real life is it can be a lot sometimes. So I love that you found the program helpful to kind of help support you through that. And in the program, we do have you work on that professional experience piece. So that second half of the program, you just want to share a little bit about what you've been working on for that and how that's been going.
Yeah, I chose a change project, and there were already a couple charge nurses on our unit conducting a training for 12 to 13 different nurses who hadn't really received any formal, like ED specific critical care training because a lot of them were hired during COVID. There weren't as many resources for education, etc. So I hopped in and helped with setup and data analysis for a bunch of different skill scenarios that were in these 4-hour sessions. And we went over a lot of skills that are commonly used in the ED, such as like RSI, post intubation care, massive transfusions, cardiac arrest care, and then things that are not necessarily in the trauma bays, but like unstable GI bleeds and things that we just have to manage um, pretty regularly. So yeah, my role was kind of collecting, analyzing data, ultimately to like measure the confidence and competency of nurses and how they perceived their confidence in these critical care situations. And yeah, it's just been a joy to be a part of.
I've just loved your experience that you've been working on. And I think it's great you were able to jump in and kind of help with that. And I think what a great opportunity for you to kind of being new. Well, you're also getting to kind of be a part of these skills to grow your confidence there, but also helping with implementing that change and education piece, helping with the data. So I'm super excited to hear more about how that's all been going. What have you found to be the most beneficial aspect of the program?
I appreciated the tangible recommendations from this program for improving nursing practice and also how this program challenges you to take a pretty active approach to your first year of nursing and critically thinking about the work that we do.
Yeah, I love what you just said there and taking that action that first year. That is our hope with the program is that we're able to help you give you those tangible tips like you said and not make it overwhelming and just know that you're not alone too cuz it can be a lot that first year. So I love that. Anything that you would like to share with current or future residents? Any kind of top takeaways through this first year of practice, through the residency program?
Yeah, there is so much growth that happens in the first year of nursing. I would encourage other residents to keep track of it in some way. Um, there were a lot of like journal prompts that this program provides, and whether or not you use those or other things, other forms of reflection, just remember like the milestones. Because each day by day is it's difficult to see the growth, but looking back on the past year is quite encouraging to me. So I would just say, like, invest in your first year, and then also for the program, find a professional experience that excites you and not not something that you will grudgingly need to complete, but find something that's actually interesting to you.
I couldn't have said it better, Allie. I love that so much. And you've been such a joy to have in the program, and getting to be a small piece of your journey and watching you grow this past year has really been a joy for myself. So you've just done excellent, and I have no doubt that you'll continue to do great things.
Thank you, Amanda.
Thanks for being with us, Allie.